family strength and support for from the National Family Support Network. So my name is Victoria Hartman, and I'm from the California Family Resource Association. I'm the program manager there, and we are the California chapter of the National Family Support Network. And so I think most of you are probably from our CFRA member organizations. And this is just an overview of the full training, which is a 2-day training virtually. And it's just for folks to like get a good idea of what the training is about. It's a pretty intensive and like highly engaging training. So it's just a great opportunity for people to learn about what the training is, who to send to the training, what the standards are briefly. So this is just an overview, and then we'll give you more information about how to access the full training during this presentation. So without further ado, I think we'll just do some quick introductions around here. I'll pass it to Caroline next.
Good morning, everybody. My name is Caroline Wessel. I work for Homestart down in San Diego. I am a program manager for the Community Services for Families program and Family Visitation program. So we work with a lot of child and family well-being or child welfare or child protective services families, whichever stage of change you're at, to refer to those. But I am also a National Family Support Network standards trainer. So it is possible if you were to come to one of our trainings in the future that you would see me as a trainer. So thank you for letting me join, and I will be sharing with Victoria today on the presentation. And so I am much more of a program hands-on implementing on the standards. All of my team has been trained on the standards. And we've been working through, and I will share some different examples during my part, but if you have questions, I'm here to help and answer. And then are we going to popcorn it? I could toss it to Michael.
Sure, yep, pass it to Michael.
Hi, I'm Michael Williams. I'm the Policy Director at the Child Abuse Prevention Center, and I support Victoria and the CFRA team and the CFRA network, and our policy work is all about families, so I'm very involved. I also get to be involved with the Strategies Technical Assistance Program, and that's my segue to pass it on to Barbara.
Thank you, Michael. I'm Barb DeGraff. I work for Strategies Technical Assistance. We're a part of the Child Abuse Prevention Center in Sacramento. I work closely with Victoria and Sadie, with Bryn and Jordan, all my team, and Michael, of course, my boss. And so what I do is I work with counties, primarily in the Sierra region, and I try to support them in their child abuse prevention activities. And I'm currently working with Sierra County, which has a family resource center, and just hired a new staff person. So I wanted to come here today so I could share how exciting this is with them this afternoon and encourage their new staff to attend the training. And I will pass it on to Sadie.
Right. Hello, my name is Sadie Crow, and I have the privilege of helping CFRA do these standards training. So if you ever attend one, I'll be on the back end doing tech support. And I will pass it off to Bryn.
Hi everyone. My name's Bryn Paschal. My pronouns are she, her, hers, and I am the Senior Data Coordinator for Strategies Technical Assistance, and I have had the pleasure of helping out CFRA in the last few months as well. And I will tag Jordan.
Thank you, Bryn. Hi, everyone. My name is Jordan. I use he, him pronouns, and I'm the communications coordinator for PCACA, which includes CVCA, the Coalition for Victims of Child Abuse, CFRA, and Strategies TA. And it's a pleasure to see you all this morning. I'm going to pass it off to Melissa Espino.
Good morning, everyone. My name's Melissa, and I'm the network specialist for a nonprofit organization called Family Service Association. And who hasn't gone yet?
Pass it to Alex.
Alex, okay.
Yeah.
Hi, good morning. Thank you. My name is Alex Kainoa Thomas. I'm one of the supervisors for a program called FACT. It's Families and Communities Together. We're based in Orange County, and we're part of the network of child abuse prevention for the county board. Thank you. And then I'll popcorn over to Jania Kim.
Hi, y'all. My name is Junia Kim. I use she, her pronouns. And I'm the Cradle to Career Director of Program and Evaluations for Hayward Promise Neighborhoods. And some of our partners are folks that work directly in the space. I don't know if Lily's gone yet, but
yes, yeah. Lily's here.
Hi, I'm Lily. I'm one of the family liaisons here at Carpenter Children's Project, and I am part of the Family Resource Center team, and we do a bunch of stuff, referrals, help with Medi-Cal and CalFresh applications, and we have parenting classes as well. And am I the last one, or has everyone gone?
No, you could pass it to Christabel.
Okay, go ahead, Christabel.
So, good morning. I'm Cristobal Rodriguez, and I am here from Hively, a child care subsidy program agency.
Maybe pass it to Lena.
Hi, I'm Lena Baker. I just started on with First Five. I'm a brand new staff member, so my role is not totally clear yet, but I'm happy to be here and learn.
Yeah, which First Five?
In Siskiyou County.
Okay, great. Wonderful.
Yeah.
That's so exciting. You work with Karen. Wonderful.
I do.
How about Kathleen?
Hi, I'm Kathleen Buzzard. I work with Butte County Children's Services, and I work in our training unit and as well as doing some family time coaching. And I'm here just so I can learn more on how to better support some of our families that are kind of going through it with child welfare and help them get all the resources that they can to be successful in their case and in life. So.
And Kathleen, you're all going through it in Butte County. Our thoughts are with you right now.
Oh, thank you. We appreciate it. Yeah. And I think that's everyone.
Yes, I think that is everyone. Well, thank you everyone for joining us. It's so great to see you all. If I haven't met you before, your organizations sound very familiar since you're all CFRA members. So welcome to this webinar that we're putting on for today. And it sounds like you're all from organizations that could really benefit from implementing the standards. So here's the first step towards getting trained on that. So anyway, this is the overview webinar. Like I said, it's just a 1 hour. And Caroline and I are both certified NFSN trainers. So we're going to co-facilitate this overview. And we've trained together before and we're really fun. So hopefully you'll get us in your training next time. So, all right, I'm going to dive right in. So here's our introductions. I mean, we just kind of went around and did everything. This is a little bit off. You know, I went from PowerPoint to Google Slides. I don't know if you all have tried doing that before, but it gets all funky on here. So just live with me with the Google Slides. But those are us. We're both trainers. And like I said, hopefully we'll get to train you at some point. So we have a poll today to hear where you're joining us from. I know that folks already said which organizations they're from, but it would be cool to see what regions that you all might be joining us from. So Sadie, if you could launch the poll, that would be great. Great. Okay. Let's share. Yep, let's do perfect. Share the results. So it looks like the majority of folks are from Northern California. That's very exciting. We could definitely use some more services up in that area. We've got a couple from Mountain Valley, one from Central Valley, and some from Central Coast. So a great spread of folks. And we also will be hosting town halls this summer, if you haven't already heard about that, in the different regions that are highlighted here. So if you'd like to learn more about that, feel free to reach out to us. But we love connecting with the communities, and we've been taking the show on the road for that. Okay. So I think there's another poll question, right, Sadie, about what your role is at your organization?
Yes.
Oh, so what kind of organization are you representing today? Yep. Great. We've got a great mix of folks here. We've got family resource centers, networks, and other community-based organizations. Very nice. And all three of these types of organizations would benefit from the standards, so we're glad to see that you're all here. We also didn't give you an other option, so I guess you kind of had to fit into one of these three anyway. Okay. So the National Family Support Network, it is a national organization that supports family resource centers across the US. And so obviously we're the California chapter here, like I mentioned previously. It was founded in 2011 by 8 state networks, and now it's like 39 member networks, and we're working on a couple of more. I'm saying we, like I work there. I don't work there, I work for CFRA, but we're a big network across the US. So you know, we really, it's amazing how similar we are to some of these other states when it comes to the family resource centers and how different we are. California has a ton of FRCs compared to some of these other states. Some of these other states have state funding for their FRCs, some of them don't. So they're all structured a little bit differently, but they all provide very similar services, which are the core services of family resource centers. So we have webinars sometimes with some of these other organizations that come and, you know, share about their successes and challenges within their state. That's been really insightful for us in California. So we're the California chapter of the National Family Support Network, who holds the standards, and we provide the training for that as a statewide network in California. So the NFSN areas of work are connecting and convening members to enhance their effectiveness. Like I said, we are a big network across the US. We're part of that big network across the US. And so we're able to connect with other states for peer learning. We also promote family support best practice and evaluation. So those are all pieces of the standards that we promote across the state. This year, we really bolstered our training for California, hence why you're seeing some of these overview webinars, and we're increasing the training, but also offering technical assistance for implementation of the standards. And then we also, NFSN also raises the visibility and value of the impact of family strengthening and support networks. So they also support with policy and advocacy, similar to the work that CFRA does, primarily Michael throughout California, in advocating for family resource centers. Let's see. We got a script for this. I probably should stick to the script, but that's okay. We'll just roll with it. So here's the agenda for today. We'll do a background of the standards. We will do an overview, like where did the standards come from? And then we'll do an overview of the standards so you can kind of see what all the different standards are for the standards of quality for family strengthening and support. Then we'll talk about how to implement the standards at a program level and a systems level. We'll do some Q&A. We'll talk about some resources and opportunities, and then there will be a brief evaluation at the end. So the focus for the standards is on families who are responsible for raising children. So usually it's at least one adult and one child who are related, whether it be legally, biologically, emotionally. Families look different across the board. As you all know, we have blended families, we have 2 parents, we have grandparents, LGBTQ plus parents, we have legal guardians. And so all folks taking care of children need support. And so that's really what this focuses on, all different forms of families. So the standards timeline, and we're a little bit biased about the standards because it was originally developed in California. We like to brag about that. In 2012, the California Network of Family Strengthening Networks, there's a lot of networking going on here, developed the standards, and then that network merged with CFRA in the last couple of years. So originally we developed the standards, and then the National Family Support Network adopted those standards for national implementation in 2013. It feels like that was just yesterday, but it's actually been like more than 10 years now. And then in 2020, NFSN engages member networks, parent leaders, the Center for Study of Social Policy to revise the standards. And then in 2021, there was a new version of the standards approved by NFSN. And you can access the full standards on the NFSN website. So we'll give you that link so you can take a look at the standards yourselves. So the importance. The family resource centers are so flexible and they always adapt to the needs of the community, like many community-based organizations. But what makes family resource centers unique is that they kind of start from the community telling them what services are needed and build the services from there. And so they look so different across the board, but these standards are really effective in providing some structure and support for family resource centers without making it inflexible, with still allowing it to adapt to the community. And so that's kind of the importance of standards. So it makes sure that there's quality practices provided for families. We have common language and expectations for different kinds of family strengthening programs. And then it's designed to be used by all stakeholders. So standards can be used by public departments, foundations, funders, legislators, families. So it's something that kind of provides that structure and supports a common language and understanding for multiple stakeholders that are involved in family resource centers and family strengthening programs. Okay, so the standards accessibility, like I said, you can access the standards on the NFSN website. They're not for sale or anything like that. They're free for all folks who want to learn more about the standards. I think Sadie could probably put a link in the chat for you to download. And this is also the link right here, where you can sign up for getting the access to the standards themselves. Let's see. Okay, so application of the standards. So what do people usually do with the standards? Well, they can obviously implement the family strengthening and support programs. A lot of times it looks like family resource centers. It provides a framework. There's some self-assessments that you can do for your program, and it demonstrates quality, especially when you're applying for funding. Direct service staff can also use it for quality improvement or quality assurance in working with families and reflecting on where they're doing really well in serving families and where they could work on some of their skills. Networks can also use it for quality assurance and training and technical assistance, and it can also be adopted as an expectation. So some states require that all of their family resource centers complete the standards training to be part of their network. Policymakers can also endorse the application, which we're currently working on getting family resource centers written into the California state budget. And so the standards are part of that budget proposal that we're developing. So it can provide some structure to FRCs so that legislators can have a good understanding of what FRCs do. Funders sometimes require that folks implement the standards for funding. And then families can also provide feedback using the standards for programs. So there's a lot of different uses for the standards. Okay, application of the standards. Usually everybody not usually, everybody within an organization needs to commit to the program responsibility of implementing the standards. So when it comes to the training, we have folks from all different levels of staffing, including executive directors, managers, direct service staff, families, parent leaders. So everybody kind of has to be bought into implementing the standards, similar to any other kind of implementation of framework, a practice, a model, a mission, values within an organization. It works best when everybody is bought into it. And foundational frameworks. So the standards are focused on a couple of foundational frameworks, and I will pass it to Caroline to walk us through the foundational frameworks.
Well, thank you. I just want to piggyback on the last slide that talked about the importance of having everybody there, just because I do think having everybody have the voice and know what needs to be changed, and then having folks at the table that can really change it as well. So you, in a sense, when you have some of those frontline staff, you have those boots on the ground or that lived experience, understanding the needs of families, and then really having those folks that can change policy. So some of part of leadership too. But okay, you want to go ahead and move forward, Victoria? So the foundational frameworks for the standards really brings together two foundational frameworks: the family support strengthening practices and our protective factors. So let's go ahead, and just for those of you that know Sadie, Sadie is hands down one of the best tech support folks in the world, and we could not do these trainings without her. So I want to give a huge shout out to her. So as Victoria moves the PowerPoint forward, Sadie's actually going to list another poll for us. So how many of you have heard of the 9 principles of family support before today? Okay, so it looks like we have 1 or 2 more folks to answer, but it looks like that I'm gonna go ahead and let's, in the essence of time, we will end the poll. And so as you can, I failed to share.
Do you see it on your end?
Now I see it. Prior to today's webinar, how many of you have heard? Can you guys see it?
Yes.
So, okay, great. So 71% of you are saying that you have not, which is totally understandable. So the principles were developed by a national organization, Family Support America, in 1981, and they continue to guide the framework in the field today. When we look, principle 1, staff and families work together in relationships based on equality and respect. While this principle may not seem very revolutionary today, at the time it was when it was written, it presented quite a challenge to the system. At the time, the prevailing wisdom was that staff were the experts with their education, knowledge, and experience, and their goal was to fix the problem and fix the family. But this principle challenged that notion by saying that staff and families are equal. The staff come to the table with their education, knowledge, and experience, but the families also bring their own strengths, resources, and they are the most knowledgeable about their past experiences. I feel like 5 times this week I've said, you know you best, or you know your family best, or you know what your child needs. And it's all of those little details that really matter in a kiddo's life. And in a family's life. So it is by working as partners in relationship based on equality and respect that we can achieve the best outcomes for the family. So when we look at principle number 2, staff enhance families' capacity to support the growth and development of all family members, adults, youth, and children. This principle really emphasizes that we in the family support field look at the family as a whole, especially now with so many multi-generational families living together and just changes. We're not just looking at the individual. If only one member of the family participates in our activities, we want to be asking about inviting other members of the family as well. We know that when multi-family members are involved, the family will be more likely to have better outcomes. And finally, principle number 3, families are support perspectives is families are resources to their own members, to other families, to programs, and to communities. So unique to the family support perspective is that we do not see staff as having all the answers or doing all of the work to support families. Families themselves are encouraged to support other families. There is a strong emphasis on connecting families to share resources such as information and peer support. Let's move on to principle 4, 5, and 6. So principle number 4, programs affirm and strengthen families' cultural, racial, and linguistic identities and enhance their ability to function in a multicultural society. This program, commonly referred to as the diversity principle, has 2 parts. The first is about respecting and welcoming the diversity that families bring, be that linguistic diversity, cultural diversity, family structure, etc. The second is about preparing them for and connecting with the larger community where they will naturally interact with people that are very different from themselves. This will support them to fully participate in our diverse society that we live in today. And then principle 5, Programs are embedded in their communities and contribute to the community building process. The family support programs do not see themselves as simply social service providers, but as community builders as well. By strengthening families, they make a key contribution to the health of communities. They also work to develop families' responsibility and leadership for strengthening and building their communities. And then lastly on this slide, program 6 is the programs advocate with families for services and systems that are fair, responsive, and accountable to the families served. Think about some of the major systems that families commonly interact with. For example, education, healthcare, legal. It sounded like a lot of you are child and welfare involved or working with child and family well-being families. Are all of these systems fair and responsive? Often not. That's where our work comes in as family support providers to work with families to help improve these systems. If we could move forward to principles 7, 8, and 9. Principle 7, practitioners work with families to mobilize formal and informal resources to support development. There's a strong, emphasis in the family support field on resources. The most common type of family support program is called a family resource center. So there you see right in the name, the emphasis on resources. And while no program could directly provide all the supports a family might need, it's our responsibility to know how to connect them to them. Excuse me, I have a tickle in my throat. Principle 8, programs are flexible and continually responsive to emerging family and community issues. The concept of flexibility and responsiveness are very important to the family support field because neighborhood and communities change. A neighborhood that is majority Latino today might be majority Asian in 5 years. Issues emerge that significantly affect families, such as economic downturns. Programs need to be flexible and responsive to this change. Excuse me. Principle number 9. Principles of family support are modeled in all program activities, including planning, administration, and governance. This is the catch-all principle because it says that all of the above principles should be applied in everything you do. Planning, governance, and administration. These principles have implications on how we develop programs, how they're led, and how we support our staff. So next we're going to look a little bit more. There we go. So the family strengthening approach was developed by the Center for Study Policy in 2005. It is research-based and really looks to increase family stability, enhance child development, and reduce child abuse and neglect. So then the other principle that we look to bringing together, if we move to the next, and if my friend Sadie will launch our next poll, we're going to look at the 5 protective factors. So prior to today's webinar, how many have you heard about the family's protective factors framework? Okay, well, so far, we have 50% of you already voting, and it looks like it's 100% yes, that everybody, we got 1 or 2 no's. But we will go ahead and, so it looks like the vast majority of you have heard of the protective factors. I know in my programs, that is one of the pieces that the state asks us to use to measure part of the quality of our services or the impact of our services. So I will go ahead and toss it back to Victoria to start looking at the 5 protective factors. Or the 5 sections of the standard training, sorry.
No worries. Okay, thank you for that, Caroline. So what Caroline just described are some of the frameworks that the standards of quality for family strengthening are based in. So when you go through the different sections of the standards and read the standards themselves, you'll find some familiar language that comes from the principles for family support and the protective factors. So that's kind of what the basis is on those evidence-informed, evidence-based practices. But now we're going to look at the 5 sections of the standards. So like I said, I'm not a fan of Google Slides, so our beautiful pictures missing from family strengthening. That was not done on purpose. There used to be a family strengthening example there, but you know, that's okay. Technology. Anywho, so like I said, the standards are separated into 5 different sections, and within each of these sections, there are those specific standards of quality that can be used to measure programs, do program evaluation, assessment, quality assurance, those kinds of things. So the 5 sections are family-centeredness, which is working with a family-centered approach that values families and recognizes them as part of the program, integral to the program. Family strengthening is focusing on supporting families to strengthen themselves and promote their success and optimal development. There is diversity, equity, and inclusion, which is valuing, respecting, and embracing families' diversity and advancing equity and inclusion as a program overall. Community strengthening is working with other stakeholders and supporting family civic engagement, parent leadership, development, and that systemic change. And then lastly, evaluation. So looking at all of the areas of the program strengths, whether it be areas that the program's working, doing very successful in, and other areas that could use some support and continuous quality improvement. Ultimately to improve services for families. So 5 sections of the standards. So this is kind of what they are structured like. Hold on, I think I accidentally, yeah. So this is what they're structured like. So there's 15 standards, and each standard has different indicators. So the indicators will tell you where you would be if you were at foundational quality versus high quality. And so the foundational and high quality are the 2 different sets of indicators for each standard. And so foundational is the very basic meeting of that standard. And then typically the programs build on foundational to reach high quality. And so, when you're thinking about, whether the program has quality or not, foundational quality is still quality. And so many times folks are approaching foundational quality, they're not quite there yet. But there's a program self-assessment that once you complete the training, if you're needing support with doing that program self-assessment, we can definitely support with that. But usually folks start at foundational quality and move to higher quality. So an example. So each of the indicators is followed by some examples. So you'll see under foundational quality, there are a couple of examples of what it might look like in a program for foundational versus one that is high quality. So what are some examples of what high quality would look like for that specific standard? Now, those examples are not a list that you have to meet as a program. They're just examples. So you might have something similar and maybe you have a program that's totally different, but just taking a look at those examples can help give you an idea of what implementing those specific standards would look like. And so usually when you go through the training, you are encouraged to come up with your own examples of what you do in your program to meet those different indicators of the standards. So a little bit more about the quality indicators. The foundational quality indicators create a solid foundation for family support and strengthening programs. They're designed to be met within basic resources of a typical family support and strengthening program, which, a lot of times could be Family Resource Center, but also seen as community center or other community-based organizations. And then, like I said, high quality indicators build on the foundational being in place first. So you don't just jump to high quality, you have to start with foundational. And then, to be able to serve families most effectively, programs really want to strive for high quality. And so when you do a program self-assessment, you might see that you are at foundational quality. You'll develop some strategies for how to meet high quality, but you're not expected to just jump there immediately. Oh, well, we're not doing this yet, so we need to, immediately change this. There might be some things that you could change immediately, but sometimes it takes time. So sometimes it takes training, implementing different strategies, things like that. So it's always working towards that high quality. And then this is the continuum of quality practice. So like I said, sometimes organizations may not quite be at foundational quality, but there are some steps in the standards you could take to reach foundational quality. And then from there, you can meet high quality. So you'll see at the bottom, there's this arrow that keeps going because quality improvement is an ongoing process. So it's not maximum quality, it's high quality. And so the standards are always encouraging folks, even if you've met high quality, to continue that process and where there might be some areas that you could continue to improve on that specific standard. So implementing the standards is a developmental process, and it's common that programs may see aspects of their work at different points here in the quality continuum. So it's not an overall evaluation. It's kind of looking at the standards in different areas of the program to see where that work might be. So you might be, at foundational in one area of your program, and then you might be at high quality in another area of the program. Just to, each standard is different. So each program is going to be different as well. Okay, so moving from foundational to high quality, like I said, there's some strategies and steps that would need to be taken to move from foundational to high quality. For the first 4 sections of the standards, remember there's 5, so the first 4, you'll see this arrow here in the middle that's used to explain the movement from foundational to high quality. And so on the left, you'll see like foundational quality, and on the right, you'll see high quality, which represents the deeper integration of the standards into your programs. And so what moves from foundational to high quality is typically a formal structure, which would be a design, policy, procedure, or intentional strategies with committed resources that ensure consistency of the practice. So it's not just like a one-time, activity, but something that's consistent over time. So that's a formal structure. Staff training can also move from foundational to high quality. So supporting the implementation of the standard through staff training. And then family partnerships. So partnering with families to implement the standard is also a way to move from foundational to high quality. So each of these elements helps to ensure that the standards are more deeply integrated into program practice. So for example, foundational quality, you might do something that's good practice, but how do you ensure that it wasn't a one-time occurrence? And so at high quality is where there's like systems in place and training that will ensure that it continues to happen. And so particular elements and the number of elements needed for high quality differ for various indicator pairs through these different standards. So sometimes you'll see like just formal structure. Sometimes you'll see formal structure and staff training. Sometimes you'll see a combination of these 3, but it's always going to be this 3 and nothing other than these 3 for those first four standards. So these are the different strategies that you'll need to be able to move from foundational to high quality. And there's examples of what that might look like. And the training lets you do a lot of practices so you can apply it to your own program. Okay, so we're going to do an example here. So this is one of the standards, standard for family-centeredness 0.1, program engages families to participate in program development and implementation. So you'll see the foundational quality is that the program solicits input from families to shape and plan the program and services. And the high quality is that program's design supports partnering with families to have an active role in the development and implementation of the program. So you can kind of see the difference here is that the program, asks for input from families. And so, maybe they do a survey or something to collect information. And that's great. I mean, that's not bad for you to do that. But to move from that foundational, kind of quality of it getting input from families to high quality, the program would design and support partnering with families. So maybe they have an advisory board, or, maybe they make sure that families review specific programs or decisions that are made before implementing with the program. And so you'll see the difference between doing a survey to collect feedback versus actually partnering with families and designing the program. And these bolded letters are usually where you can see the difference between foundational and high quality. So here you'll see an evaluation arrow again. So as with the arrow we use in the first 4 sections, this last section for evaluation is going to be a little bit different. So this is the 5th section of the standards. And so the elements here are data analysis, which is collecting data that, just collecting it is foundational, but analyzing it moves to high quality. And then there's sharing evaluation results, so with various stakeholders, including families that you work with. And then there's program modification, so not just collecting the data, but actually making changes to the program as a result of what you learned from your evaluation. So you're not just doing it for evaluation's sake, you're actually doing something with that evaluation and implementing it. All right, so some implementation tools here. So with the standards, there are some additional tools like the program self-assessment tool, which is something that I've referred to a couple of times already. So it would be designed for program teams of managers, direct service staff, parent leaders. It's designed to be used as a critical thinking exercise by program teams to do together. So it's recommended that all team members involved in using the program self-assessment tool have been trained on the standards first. So that's why we really encourage folks of all different levels to participate in the standards training. Then there's the staff self-assessment, the staff reflection checklist. And that's 18 questions for staff members to use as a daily reminder for how to implement the standards. So they're encouraged to put it in a place where they can see it regularly, like over their desks. And then the last tool is the participant survey. So it shows how well the program is meeting the standards from the participants' point of view, so from the families that are being served. And it's not like a typical satisfaction survey. So the questions mirror those from the staff checklist. So staff are like mindful about what they're doing according to their self-reflection checklist. Then the program participants are likely to give high scores on the participant survey. So it's very much mirrored the staff self-reflection checklist and the standards participant survey. And we review all of these in the full training as well. So the training, like I said, this is just an overview of the training itself and the standards itself. So there's a certification training, which is typically what CFRA provides statewide. We have a couple coming up this year, but there's also options for private trainings, and we can talk a little bit more about that. So people will go to this training, the certificate's valid for 2 years. And then there's an option for training of trainers. So specifically, particularly in areas through California that don't have a lot of trainers, like maybe Northern California, we could support a staff member or somebody who's already taken this certification training to become a trained trainer, like Caroline and I are, to implement the standards within your region, but also have opportunities to train other counties and other organizations across California. So if that's something that your organizations are interested in having somebody trained like Caroline and I are, then we can work with you on that, and we can connect you with the National Family Support Network and support that process. All right, so certification trainings nationwide. This is just some data on what that looks like. So these are all the different states that are implementing the standards, and you can see how many trainings are conducted across the US. You can see that California has the highest number because we're not the best. Okay, I'm not going to say we're the best, but we do have a lot of people that get trained on the standards training. And then we have the highest number of certified individuals as well. And we currently have 8 trainers, I believe. We might have a little bit less. I think every year they have to renew, and there's certain requirements for it. Or maybe we have more. I'd have to ask Debbie. But Texas actually has the most trainers, even though they haven't done as many trainings. So they're one of our partners that we work with, and they actually will be doing a webinar for us in a couple of weeks. Training impact. So most post-certification trainings show that 91% of respondents to this post-certification training said that the standards enhance their programs work with families, and 85%, we're actually using the standards implementation tools that I just reviewed. So here are some quotes about the training impact. So folks really like the training because it gives them like a framework and strength-based approach to evaluate the services they're already providing. One of my favorite sections of the standards is the diversity, equity, and inclusion section, because it gives you some concrete examples for how to actually implement that, because folks kind of define that a little bit differently across the board. And the way that it's facilitated in the training, you can't learn about everything about DEI in 2 days, right? But it does give you some starting off points to start having those conversations within your organization and what concrete examples would look like of implementation. So that's my quote that I would add to this. And supporting network development. So networks have been formed and expanded through the training. They're strengthened and they're strengthened further when they have their own trainer. So like I said, people, different counties, organizations across California can send their trainer to be trained as well, like to have a staff member trained. And then all of the funds that come from the standard certification training go back to supporting networks. And so the National Family Support Network does collect certification fees, but it goes back into supporting networks across the US. And this is the program implementation continuum. So I will hand it off to Caroline. I know we have about 10 minutes left, and we can definitely send this out as well if we don't have a ton of time to get through it, but go ahead, Caroline.
Okay, great. And I did want to, I think Alex put a question in the thing in the chat about, it is a 2-day virtual training. And it is typically from 9 to 3:30. However, there are significant breaks. I will tell you, and my team just took it, and I had two that struggle to sit all day on a computer because they're usually out in the field, and both of them, and they were dreading it, and they're like, please don't make us do a 2-day training. And they actually both came back and said that it was by far the most engaging training that they had ever been to, because we do so many, we really try to accommodate all different types of learners. So you'll have a book that you can reference to, because I'm one of those people that likes to have a book. We have breakout rooms where you're going to do discussion in small groups. We have multiple different types of activities where there's, if you even noticed in this presentation, we've done polls. We haven't asked you to give us emojis, although I'm hoping maybe you'll clap for me at the end. Just kidding. Or maybe, as sometimes Victoria and I will go crazy with emojis, so I know she's gonna throw up some flames because I'm on fire today. But we really try, again, we meet all the visual learners, the folks that need to hear it read out loud. We try to do all of those different types, so it really keeps moving. It really goes, if anything, folks say it kind of goes too quick, but it really does, it is very engaging. So this is the program implementation continuum, and I believe Sadie, our wonderful tech support, has already put the link to get some of those free kind of resources, but this is at a program level what it could possibly look like. And I'm not going to read this to you because we don't want to read it all and bore you to death. I will tell you, just to kind of help sell this, and Sadie just re-put the link in. And feel free to download this and take a look, but this is really where you're looking to prepare, to promote, have folks attend the certification training, and then start with that program self-assessment. And then that's where you're really moving into that infrastructure of the implementation and planning, and then obviously figuring out how it went. So really measuring the quality and improvement, and then continuing. And I just wanted to give a real quick example. I know we typically look at all of our programs that we want to do a self-assessment for, but my team has the great benefit of, my agency has an equity at work committee and a diversity committee. But unlike our programs that are either county or state funded and come with a contract with all these, goals and measurements that we have to reach, those kind of homegrown, created in the agency committees and things like that are so important, and to make change in the agency, we really did a self-assessment on some of those local committees that are just our agency, that are not necessarily prescribed, and really looking at the equity at work and diversity when it comes to diversity, equity, and inclusion really benefit, so that we can build that infrastructure and really be inclusive. So this is an example of a program implementation. On the next slide, we are going to see, again, the continuum for a larger scale and network implementation. So again, the standards are great because they can be applied to all different levels. So a committee like Equity at Work, a program like community services for families or an entire network. I know I had the opportunity with being with several folks from the Bay Area in one of our last trainings and really developing that network as a whole and looking at how they can improve some of those relationships and just build that infrastructure and quality and kind of get the feedback from the network as well. So if we actually jump to the next slide, we're going to see a network implementation example, and this is from San Francisco. So again, we're looking at the diagram that they use a three-pronged strategy, that they integrate them into training, evaluation, and membership. So we're looking at training and evaluation, also sometimes called assessment. So each network is really encouraged to develop their own one network level implementation. And then on the next slide, we're actually going to see how a different network did it. And this is actually a network in Colorado. They've tiered their trainings for Family Resource Center staff. All staff at the centers, regardless of roles, complete the standard certification training. Staff working with families and their supervisors do some strengthening family trainings offered by the Children Trust Fund Alliance. Staff working directly with families in case management roles complete the 60-hour family development credentials. But again, you do what fits your agency and it's all in your network, and you really personalize it to go to your specific needs. So on the next slide, we're going to talk a little bit about why adopt the quality standards and things to keep in place or things to keep in mind. It really considerations is the deepen practice, establish the common language. I don't know how the rest of you guys, even when I introduced myself as working with child welfare families in San Diego, we now say child and family well-being. I know some of you say child welfare services. I think most of our families that we work with still say CPS. Again, all the same agency, and we can't seem to come up with a common language. And then we've kind of added on, and I think this training was really important for my staff to not only establish a common language, but establish a trauma-informed common language. So really looking at, and one of the things that my team decided to do is to get some of that parent feedback to be like, what term would you like me to use so that you feel safe and respected? How do you want me to refer to what we sometimes call caregiver, foster parent, all of those types of things? So really trying to look at some of those different languages. But then really looking also at developing partnership opportunities, utilizing shared measurements. Again, shared measurements are so important because a lot of us know we have to do outcomes and we have to be able to show, and we want to make sure that we're really making a decent impact. So doing something concrete to advance diversity, equity, and inclusion. Victoria said it, but my favorite section is also one of my favorite activities also comes in the DEI. And after I took the standards training for the first time, that was the first thing I brought back to my team, and we did that exercise. So, and this is part of the national movement. So I can't say enough. I'll be happy to answer questions later if you want to hear about some of the things that we've done, but otherwise I will toss it back to Victoria to talk more about next steps.
So some next steps for you all could be to download the standards that Sadie put the link in the chat to do that. And then maybe you want to take the program implementation or network standards, continue to your organization, have conversations about how you might want to implement the standards, and then the training that we have coming up in the next couple of months. So before we dive into next steps, like what are the trainings and the events coming up? Are there any questions? I know we don't have a ton of time left, but wanted to make sure that folks had a chance to ask any questions. No? Well, we were chatting, trying to get everything into 1 hour. So think sometimes people are like, that's a lot of information. So if you have questions, please feel free to reach out to us. I know we tried to squeeze a lot of content into 1 hour, and it's a lot more engaging when you actually take the training. Not that we're not engaging ourselves as we are, but if you have questions, please feel free to reach out to us. Our team is always available, and there's information on our website as well. Let's see, actually, let me check the chat. Okay.
The chat, so the link for the next training, Sadie was nice enough to put in, and then Jordan was able to put in some info about the standards. Some links, so.
Yep,
Great
yep,
job.
perfect. Yep. Okay. So, one other thing about the standards is, like I said, we can also offer technical assistance for implementation. And so when you take the standards training, we partner with Strategies Technical Assistance, which Michael oversees, and we can help with program self-assessments, working through specific standards, meeting with your team about those continuum. And we have a menu of different types of technical assistance we can offer for standards implementation. And so once you take the training, if you're kind of like, what's next? What do we do after this training? During the training, we talk a little bit more about how to get involved with that. But I think Michael can also put some more information about our TA services for the standards as well in the chat.
Yeah, I put a link in, and I think it's the training that we make available to everyone comes with a fee per person, a reasonable fee. It is no cost to you if you have a group of people of at least 24. Is that right?
Yeah, just 24 people.
At your organization, it comes with strategies helping you through some of those points on the continuum that Caroline shared. That someone probably being Victoria, but we do provide that sort of TA.
Yep. So there's a cost associated with taking it. So if you're enrolling like individual staff, it's either $115 for CFRA members or $150 for non-members. However, if you have a team of at least 24 staff that need to be trained, we can do a private training with no cost, and that would include the technical assistance that Michael is talking about. So if you have a small team and you are hoping, like, you'd like to access that free training, you could partner with another organization. It just takes a little bit more administrative work on your end. And some really quick events coming up for CFRA members. We have a network opportunity. Like I said, we do have our partners in Texas coming and talking about their philanthropic funding strategy. We have our upcoming policy committee and our upcoming CFRA member update call. And if you're not a member yet, feel free to reach out to us and we can, get you connected with membership as well. And these are the open trainings. So we have one coming up for the 5th and 6th of September and one for the 5th and 6th of December. And those are on the website that I think Jordan posted in the link. And that's it. So these are the contacts for training. Caroline is our co-facilitator in training. She's well, I would say she's one of the best standards trainers. But I'm biased because we started training around the same time. But I was about to say Victoria, myself and Sadie are both the contacts for the standards training statewide in California. So if you have any questions about how to implement the standards training, the cost, or wanting a private training, you can reach out to us for that. And I think that's it. And so what we have is an evaluation that Sadie will plop into the chat. And that'll be it. Thank you all so much for coming to this webinar. I know it was a lot of information into 1 hour, so quite a few of you stayed behind. So I'm assuming that you're interested in the standards training. But if you could fill out that evaluation, that would be great. And we hope to see you in an upcoming training.
Thank you.